this very famous and very important person who has revolutionized the way we look at patients and healthcare on the dais. Thank you, sir. Thank you.
PPT. So good evening, everybody. This is a proud and a prestigious moment we have been waiting for. And it is really a historical moment that this ski meeting has a motivational speaker in the form of Nageshwar Reddy, sir. Let us first welcome him with a big, big round of applause. He needs no formal introduction, but I think it is my duty to introduce him very briefly. He is the chairman and chief of gastroenterology at the AIG group of hospitals. He is the one who's founded it. The current flagship hospital, which is his brainchild, is 850-bedded hospital at Gachibowli. Another one is 300 beds at the Banjara Hills, and the 150 beds, the older one, at the Somaji Guda. I have had the privilege to visit Nageshwar Reddy sir in his flagship hospital at Gachibowli, and what they say is, seeing is believing. I went there about 2 months ago, and I was flabbergasted to see what was going on there. In a nutshell, he sees totally about 4,000 patients in one day. He does 750 endoscopy procedures in one day. And I was amazed to see those endoscopy suites and how the patients were registering. And if somebody has used AI to the optimal level, it's none other than Dr. Nageshwar Reddy, because with his vision, he has enabled the registration systems. He has enabled for people to pick up the red flags where there may be waiting time has gone up more than 30-40 minutes. The height, weight, the primary of the patient, the basic data is captured by sisters in literally 30 seconds, 1 minute, and the doctors have it. So, in short, what he has created there is fantastic. He has shown us what AI is, and he has something called as a Mira, where, he has used, if you're just talking, dictating history, it will capture everything. It will put it in a small kind of a note. There are questions you can ask to this AI person and you will be answered. I can go on and on about this, but I think if some of you want to see what healthcare can do and what is the pinnacle of healthcare, then you've got to visit Nageshwar Reddy sir's hospital in Gachibowli. That is something which is phenomenal. His commitment to innovation and patient-centric care has made him one of the most respected medical pioneers of our time. Dr. Nageshwar Reddy's brilliance lies not only in his clinical expertise, but in his ability to inspire, elevate, and build institutions that shape the future of medicine. Single-handedly, he has transformed AIG into a global benchmark for excellence in healthcare, and for this, he has been given the 5 ASG Crystal Awards, which is a very prestigious award given by the American Society of Gastroenterologists and Endoscopists, which is the only award outside America for any person to receive. And Dr. Nageshwar Reddy has received that award. It's really very, very, very commendable. At the same time, he has also received the John Hopkins Captain's Chair Award. Dr. Sabyasachi from John Hopkins is here. And nobody else has received this award outside the US except Dr. Nageshwar Reddy. He is also the inventor of Nagi stent, which has really revolutionized the treatment of gastroenterology, and it is indeed a very, very useful innovation. He's amongst the few handful of doctors or few people in India who have received the Padma Shri, the Padma Bhushan, and the Padma Vibhushan. All 3 awards received by Dr. Nageshwar Reddy. I think I should not introduce more and more, because We have short time and he has a flight to catch. He's going to get a flight at 8:50 where he has to travel. So sir, we are honored to welcome you and we wish to felicitate you with the Puneri Peshwai Pagdi, which we have got all the way from Pune for you. With Dr. Sachin, if you can give the Pagdi. The shawl first. Rajgopal sir, you can give the Pagdi. Dr. Ashok Sham, please come up.
May I kindly request a standing ovation for Professor Nageshwar Reddy, sir.
So friends, today we are very excited to hear this talk and you will ask what is the connection between orthopedics and knee surgery and gastroenterology. Today after this talk, you will realize, what is entrepreneurship, how doctors can be entrepreneurs and how should doctors approach it so as to become the best in the field. And for this, may I invite Dr. Nageshwar Reddy sir to please enlighten us on his talk, Doctors and Entrepreneurship. Over to Nageshwar Reddy sir.
Thank you, Parag. Thank you very much for that very kind introduction. In fact, Parag said that I must give the oration the cap on, but my head would have become very heavy. I don't want it to. So Parag actually told me, can you talk on something to make the doctors very successful? The orthopedic meeting is there, can you make? So I said, how many minutes? He said, you have about 15 minutes to do this, to make all of you very successful here. So I'll start with this question, what is success? Success is power, success is fame, success is money. So how many of you, let's start by finding how many of you are successful here. How many of you have lot of money? I thought Ashok Rajgopal, no? Only one, okay. How many of you have fame? Again, lot of you are very famous. At least few hands. No? And how many of you are very popular in your... Everybody is popular, nobody is raising hands, they are all shy. So at least let us assume that 10-20% of you are very successful in terms of money, fame, popularity and so on. But still 80% of doctors are not, so I'll change it a little. Success now has been redefined completely. Success means, the meaning of success in all sociological magazines or journals are, success means being happy with what you're doing. So how many of you are happy with what you're doing now? See, Parag, 3 minutes I converted everybody into successful doctors. So I think our concepts are so different. My talk is going to be very brief today on doctor and entrepreneurship. In fact, the term entrepreneurship is a term that I didn't know till recently. To give you a little background, I'm a gastroenterologist. I did my gastroenterology at PGI Chandigarh, DM. I did a little training in Germany on advanced endoscopy and came back. I started practice here and over a period of few years built up these 3 large institutions, I think Parag already told you. So people started labeling me as entrepreneur. I didn't actually know the meaning of entrepreneur. So when I went back to ChatGPT to check what is an entrepreneur. An entrepreneur is a person who initiates, organizes, operates a business venture, taking on greater than normal financial risks in order to do so. The ultimate goal is achieving financial success, realizing personal business, or addressing a social need. So I thought maybe I may fit into this, and I think all of you look at this definition and see how many of you could actually fit into this. So my journey has been starting as a small practitioner in gastroenterology in a 2-room just 2 rooms, one for consultation, one for doing endoscopy in 1984. Then I had a long story, but I don't want to go into this. A lot of luck, serendipity, and so on helped me to make the first 200-bedded hospital, old hospital, Somajigoda. Subsequently, we made the large, the present Gachibowli Hospital of 850 to 900 beds, and then came the Banjara Hospital, which we recently opened, 300 beds. So I call this an accidental entrepreneurship because I didn't realize all the values of entrepreneurship when I started this. What happens is many of us, we finish medical school, go into individual practices, go into group practices, then sometimes build a small nursing home in our towns, join corporate hospitals. Very, very few of us actually go into building institutions. I think Professor Sancheti, Parag's father, was one of the few ones who did it very early on. And incidentally, he was also probably at that time the only doctor who got all the 3 Padma Awards. Yeah. So ultimately we come to, so why not? Why isn't everybody doing this? Why isn't everybody building institutions? Why do you just build a small nursing home? Why do you join a corporate hospital, give all your skills to develop, and that hospital develops, but you are only a part of that hospital? Why not you're doing? The reason is this. The reason is we have, as doctors, when we pass out of medical college, we have what is called the middle class mentality, which is very different from entrepreneurial mentality, very important. Middle class mentality means wealth. Doctor, you want to go, you want to do practice, make money for your family, invest into lands, invest into real estate, make more money. And this is a middle class mentality of wealth. When entrepreneurial mentality, which many leading entrepreneurs now have, many of them are engineers and so on, startups and so on, they have what is called a valuation mentality. So they don't create wealth, they create a value. And value is much bigger than wealth, because value is not only creating a wealth for yourself, but wealth for people surrounding you. Like Infosys is created by Mr. Narayan Murthy. He became very rich, but he not only became rich, but he created a value so that everybody around him became rich. And also it created a value in the society. So we are all bogged down as doctors by this middle class mentality. We have to get out of this and think of an entrepreneurial mentality. That's the most important thing. The reason why we don't also is because we are not taught how to do this in our medical college. Medical college only teaches you skills. You can become an excellent physician, excellent surgeon, excellent orthopedic surgeon, become the top guy in knee, hip, or whatever part of the thing you're operating. That's what it teaches us, man. But it never teaches us how to be an entrepreneur. It never teaches us how to manage people. Doctors are the poorest at managing people, and never teaches how to manage money. Because money is a bad word because we are all supposed to be helping poor patients. So if you make money, it's bad. If you don't have money, it's bad. So we don't know how to manage money at all. So these are the 3 important defects that come, and that's what happened to me. When I came out of PGI Chandigarh, I was coming from a very low socioeconomic class. My father was a professor of pathology, never made any money. We never had. So I came out with about 5,000 rupees. That's all, I just had that. And then started my journey. The first few years, I was doing very heavy practice, endoscopy, and made a lot of money. And then about 5 years into this practice, when I thought good amount of money, my father called me home and, after lunch, told me, son, you're a big failure in life. I said, failure? I went to the best college, graduated, I got a big practice now, and you're saying it's a failure? He said, yes, you're a failure because have you built any institutions? Have you taught any students? Have you published any research work? Have you looked after downtrodden? None of it was there, zero. So in his thinking, this was the success, and my success of just making a lot of money in practice was a failure. That day I decided that I'll change my course. Now, that's when I started thinking like an entrepreneur, but there were a lot of other interesting incidents which helped me build these institutions. I can't go into because of lack of time, but for you who are sitting here, the most important questions that you think about is 2. Why should you as a doctor, why should you as a great orthopedic surgeon, very skilled person, very successful in life, why should you think of being entrepreneur? That is the first question. And second, if you think of being an entrepreneur, how should you do it? As I said, I didn't know anything about it. Most of my knowledge is diffusion. When I look back, these are the important factors. I thought I should convey these to you. Why? Because we don't realize this, but doctors actually make the best leaders. So, but what is happening now, all of us are joining corporate hospitals and these hospitals, and they are run by individuals who make us work. They are leading us. In terms, if you think of the intellect, in terms of what they can do to society, they are much below us. But these corporates are leading us because they have taken over. They know the business of medicine. They are entrepreneurs. And we should not be left behind. We should run our places. Doctors themselves should be the ones who are running all these things. And that is the reason why we should start thinking as entrepreneurs and not as just workers in these hospitals. The other thing is, however good you are at your job, however great you are, a point comes when you develop a burnout syndrome. A burnout syndrome is one, you're working very hard, you do very well, but you get fatigued, you have a sense of loss of sense of identity and so on. There's several definitions. So very successful doctors, many of them, after a certain period of time, develop a burnout syndrome. And the only way to avoid it is to be an entrepreneur. And when you're an entrepreneur, you never develop a burnout syndrome. This is an important point. So next, we'll come to how. How do you become an entrepreneur? The three important shifts. Again, this was my journey. I learned it retrospectively. Leadership, team building, and managing. These three things you must know. If you know this, then you can conquer. You can become a great entrepreneur. Let's start with leadership. Leadership is a very tightrope walking. It's a very narrow pathway. Again, I learned it over a period of time. In leadership, you realize that you have to be strict with the employees, but sometimes you have to be very soft. So it is oxymoron, many of these. You have to be dismissive. A lot of employees come, talk to you, try to... Again, I think Parag should have having considerable experience in this. They'll come and tell you all sorts of things. And sometimes you have to appreciate you when they have done things. Appreciation is very important. Sometimes you have to be disconnected. If you go on listening to all the things that they say, you get so involved that you do micromanagement, that's not good. But again, there are occasions where you have to be empathetic. Somebody has lost their loved ones. Among your employees, empathy is very important. The three most unused phrases that I found, which I learned are very important in leadership, is first to say thank you when you have something is being done. Second is apologize, and sometimes apologizing in public to somebody whom you by mistake scolded, did something, makes a huge impact on the whole group itself. They know that you are empathetic, and when you apologize, that makes something. And the most important thing I've learned is whatever decisions we do in a hospital, I always ask the doctors around me and so on, what do you think? Okay, we want to start this new department, what do you think? This what do you think becomes very important because you get a wide opinion. Even now, all of you in your practices, in your nursing homes, some of you may be running bigger institutions. When you do something, if you ask your colleagues, what do you think? Should we do this? It makes a huge impact. Not only do they respect you, but also you get very good opinions on this, very diverse opinions. So this is something that... The other thing, I was actually the president of the World Endoscopy Organization for 4 years. It involved 150 countries. I was very immature. I didn't know how to lead at that time. And one of the occasions, there was a French doctor who made a mistake. I just shouted at him. And the secretary, who was just a lady, secretary of that organization, called me and said, "Doctor, this is not the way how you do it." She told me the way how to very effectively shout or scold at people is the sandwich technique. And that I found extremely... What is sandwich technique? You want to shout at somebody, you call him to your room, not in front of him, call him to your room. First praise him or saying you're doing a good job and so on. First 2 minutes just praise him. And the next 30 minutes you shout, you scold him, do everything. And afterwards, as he's going off, you tell him, okay, you're doing a good job, keep it up. So this is called the sandwich. When you do the sandwich technique, the opposite person doesn't realize you scolded him. It comes to him very slowly. He doesn't feel very abusive at you, and it's a very effective way of dealing with people, and this is, I found, extremely useful. The second important thing is communication. There's, in fact, again, as we get trained as doctors, many of us get very skilled, we become good doctors and so on. The difference between a good doctor and a great doctor, the difference between a good doctor and great doctor is skills of communication. Now, Mr. Senior Sanchetti became a great doctor because not only the skills of doing procedures, but because of the skill of communication. And we all think that communication is just talking well to all the... Communication is talking 25%, listening 75%. We must have, as leaders, the patience to listen to what people say, absorb everything. And if you look at all the great leaders, even all our prime ministers, chief minister, all of them have gone to that stage. They listen very well. Listening is a very important part of communication, and we don't realize the importance. So this is another important component. So this is what Angela Duckworth, who's written this very famous book on power of passion, says that talent and effort makes a good skill, but if you want to, from a good doctor, become a great entrepreneur, a great doctor, you have to have the skill of communication. You have to have the skill of communication, of telling the investors, look, this is the best place for you to invest, of telling your friends, this is the best place for you to come in, of listening to what they say as counters and then starting to reply to them. So this is how, what differentiates all of us are good doctors, but to become a good entrepreneur, you must have skills of communication. And skills of communication is something you can easily develop. The second aspect of entrepreneurship is team building. Again, this is something we are not taught officially. Team building requires certain effort, and this is, again, a very important component of building institution. In fact, I was having dinner once with Mr. Narayan Murthy, who founded the Infosys, and I asked him, so whenever I meet very important people, one question I always ask them, what is the reason for your success? So I asked Mr. Narayan Murthy, can you give me in one sentence, what is the reason for your success? And he said, I don't want a sentence, I just want one word, and the word team. Word is team. So the reason for success for him and reason for success for many of us who are going to build institution is teams. Teams are the ones which make us. So Henry Ford very famously said, coming together is the beginning, to keeping together is the progress, and working together is success. And I think the only way we can be successful, small group of doctors, big hospitals, bigger group of doctors, is by team. Individually, we cannot do anything together. Because if you have, what happens is, in your college, for example, or in your school, you would have found many people who have been at various stages in life, you know. There are people who make things happen, there are people who watch things happen, and there are people who wonder what happened. So you should not be left behind as somebody who wonders what happened. You should not be somebody who makes things happen. You must not watch things, you must make things happen. So this is very famously said that real success comes to the doers, not the observers. We observe what such person successfully did this and all. You can go on observing, but that doesn't make you successful. Only the doers become really successful. So we, again, in our group, we have several people in the teams, and we know who's a winner, who's a loser. Winner has a solution for every problem. The loser has a problem for every solution. You know, you ask some, so what shall we do for this? They'll give some excuses. No, we cannot do this. Is their government regulation, this regulations and all. But a winner doesn't think of all that. He says, this is the solution, let's do it. So this is very, very important. So surround yourself with positive people. If you want to be a great entrepreneur, surround yourself with positive people. Take out the negativity. If you have negative people around you, they drag you down. It's the positive people who will drive everything. The negative people, either you convert them into positive people or they go out of your group. This is very, very important. Positivity is something that radiates around the room, that creates an atmosphere where everybody succeeds. Negativity pulls everybody down. So very, very important again. So I was once in this very famous group of entrepreneurs in Hyderabad. They called me as a medical person. They were industrialists. They were very famous startup companies and so on. Mr. Ramcharan is a leader of, he's a Harvard professor who will teach you how to do management. I couldn't afford to go to his courses because they're very expensive. They charge a couple of lakhs. But fortunately, this time when he came, the Harvard invited some of us to interact with him. And when you interact with him, he asked one question to all the people, all the successful industrialists there. How do you recruit people into your team? Because they're all very, everybody was successful entrepreneur. And everybody is saying, I'll take this brilliant guy, I'll take this chap who's done a lot of work in this area, put them together. So when he came to me, I told him, I'll take a very average person as part of my team. He was very surprised. What do you mean average? I have to tell you that in medicine, you don't require brilliant people, you require average people. But you require people who are passion, and are a team person. So I think when you recruit your people for the team, three things you must see. Are they compassionate? Are they passionate about their job? That They don't leave everything at 5 o'clock and go back to their family because they have to, but they have the passion to continue. Are they part of the team person? If you take somebody who is brilliant but not a team person, it'll destroy the whole institution. So what I figured was the best people for you to build up your teams are average people, compassionate people, passion, and team persons. I think this is a very important formula that we should keep in our mind before we build teams. So this is the reason why, to a large extent, we have succeeded, mainly because of the team, all the publications and all that is because of the team. Individually, it's impossible to do these things. And this is very important to emphasize. So I'm running this large hospital. I think Dr. Reddy also is here. He also used to run a very large place. So people ask me, how do you do all the clinical work? You're running this. So the formula that I developed is that I'm still very passionate about clinical. I don't want to leave my clinical work. If I had a choice between doing good clinical work versus not running a hospital, I'll do good clinical work. So I've now made a formula where 70% of my time I'm in clinical work, seeing patients, doing procedures. 20% we have a large research wing, research and academic wing, which in fact we have 2 Nobel Prize winners as part of a faculty who come to visiting, Barry Marshall, who discovered Helicobacter, and Maria Lucina, who discovered the genetic knockout mice. So they're part of a faculty, so they come, we have a lot of discussions. So 20% of my time, along with our research group, I spend, and only 10% of the time I spend administration. The trick here is to delegate your administration to a group of people who can do it, because they're all not doctors. There are like chief operating officer, chief financial. They're all people who are trained to be doing this administration. The most important thing for us as doctors when you're doing this is to get the right group of administrators whom you can just give everything, and you spend just maybe half an hour or 1 hour every day on that aspect. They look after everything. So this is again an important trick. If you try to do administration yourself full time, then it goes nowhere. And then you have to be willing to sacrifice your clinical part for doing this. And I know, seeing all of you, that you wouldn't want to do it. For you, clinical is still the most important. But to be successful, you can do this very easily. So one of the things that's not often used in medical or even in entrepreneurship. Intrapreneurship is what you do in your hospital. Entrepreneurship is what you do from outside. Now, entrepreneurship is keep testing your people, your administrators. You give them a problem, see how it is solved, see which administrator is better, and then start delegating work. So this entrepreneurship is also very important. Constantly, however big or small your institution is, you have to constantly keep practicing this entrepreneurship. So the last important part is managing money. This is something I was very bad at, but you have to learn. To be a good entrepreneur, you have to learn managing a lot of money or managing no money. If you don't have money, what to do? This is very important. So I think this, I often quote what Richard Branson said, that we went into business not to make money, but if you have fun, the money will come. It's exactly the same with doctors. We don't practice to make money. I think this is universal. We practice because we have a passion. You want to cure the patient. You enjoy doing it. Money comes secondary. It comes as part of that. It flows. This is something that we have to keep emphasizing all the time. Because one of the things is, if you want to big hospitals or big corporate hospitals, it's not so easy. All of us don't have that kind of money. The easiest way, of course, is to get a rich father-in-law. But I think for some of us, it's too late also now. So we have to depend on either taking loans from the bank or getting private equity people. This is the most crucial question. The private equity people, I never knew anything about it till later on. I was fortunate that we didn't get bad. The private equity people are divided into the good, the bad, the ugly, the ugly, the ugly. Most of them are ugly, because what they want to do, all these private equity want to invest in a very successful hospital. They'll buy it up, slowly see that the doctor has less and less and less percentage of his coming, and slowly dominate the doctor to that extent that we have examples in India of big founders of big hospitals who have been thrown out of their own hospital because the private equity guy comes. Their bottom line is graphs to see how every month your percentage of income is increasing. They don't care about anything else. So it is extremely important when you select. That is one. The second thing is, as far as possible, we think bank loans are bad, but bad private equity is worse. So as far as possible, limit your private equity involvement to less than 30%. Whatever happens, if they are more than 50%, you are finished. That is not a good institution. Try and limit it to less than 30%, definitely not more than 50%, because then you get so diluted that you don't have any say in what is happening. The reason is, of course, Reddy will recognize this person, but most others will. What again happens is, we try to do our own financial juggling, doing this and that, and we are very bad at it. As doctors, we don't have the skills, we don't have the long-term vision. We are extremely bad. I found only about 10% of doctors who are really good at financial issues. So what I would suggest is, if you're thinking of building institutions, get a good economic advisor. Mostly the safest people are your own relatives. If your brother or brother-in-law or so on good at finances, take them. They are the best people. If you don't have that kind of thing, at least take a person who's going to be extremely reliable, is going to advise you. Most of the downfalls of doctors who have started enterprises is because they've had economic advisors who are doomed, who are actually the reason for their downfall. So I think this is, again, extremely important. So you have to know certain words. In fact, when I started AIG, the equity people came in, luckily good people. They asked me, what is the EBITDA, what is the ARPO? I never knew any of these words, all foreign words to me. What are all these? EBITDA is earnings before tax, depreciation and amortization. So ARPOB is revenue per occupied bed, and ALOS is average length of stay. These are important. I never even know. The reason they're very important is the value of your hospital or whatever you create is based on the EBITDA. The EBITDA into 20 is average for hospital. So if you're making 20 crores EBITDA, earnings before tax every year, the value of our institution is 400, 20 into 20. Multiply into 20. That is for the hospitals. For different industries, they have different landmarks. So this is how valuation is done based on EBITDA. So you can make huge profits and you can make huge turnovers in the hospital, but if the hospital is making only 50 lakhs per month as a profit, as EBITDA, then your valuation is 50 lakhs into 20, only 10 crores. So that's the thing. So everything depends upon your EBITDA. So that's the reason why now people don't want to build big institutions, spend a lot of money on that. They rent a place, run a very successful enterprise. Then you show a high amount of EBITDA, valuation goes up. So this is one of the tricks. Now the other thing is, I didn't realize this, that there's an inverse relationship between ARPOB and ALOS. If your average length of stay in the hospital is low, then your revenue per occupied bed is high. This is a very important principle that the American hospitals have created now. The average length of stay in an American hospital is 2 days. Average length of stay, even in the best corporate hospitals in India, is 4 days. Many of them, when we started, it used to be 6 days. We try and cut it down to 5 days. So cutting down that is extremely important, and we don't realize the importance of this ALOS. The second thing is, we don't know when you're running what should be the cost, how much loan you should take, what is the repayment that you should do, and all these things. Again, there are a lot of calculations on this, but I'll just come to the salary part. What we realize when running hospital is that for a hospital to be successful, your average salary to doctors should be less than 18%. Rest of the shop less than 18%. So your average salary burden should be less than 36% to be successful. If it is more than 36%, I've seen many hospitals going to 45%, then you won't be successful, because for the hospital to get a value, you have to limit your salary burden to less than 36%. There are things called receivables. You think the hospital is doing very well, but you have a lot of institution patients who don't pay the money. If your receivables go to more than 1 month of what you're making profit, then you won't be able to function. So similarly, it's all a lot of how much loan you can take for replacement, repayment. All these things comes from financial knowledge. But just to say that when you're running this, the operations, you think that hospital very busy doing well. No. Hospital profit comes only 10% from operations. Your theaters, you may be doing 10 surgeries a day, but that is not getting it. The profits come from your diagnostic division, 60%, and pharma, 50%. That's where your profits come from. So what you should do is, when you're running large institutions, you put very strong people in your pharma area so that no pilferage is occurring. Put very strong people managing the diagnostic area, because diagnostics has a lot of pilferage can occur, overbuying can occur. There can be nexus between people who supply all the kits and the people working in the hospital. So all these issues are there. So concentrate on that. Don't worry about operations. You don't lose money on operations. That is there. Again, as you go along, these are the 3 very important attitudes that are there: humility, positivity, and networking. I'll show you one very interesting study that came, which was done by Raj Shetty, published in the Quarterly Journal of Economics in US, where he showed that he looked at all the big achievers in life after a certain period of time, and found that those who achieved big in life, when you went back to the school and saw how they were, they found that those big achievers had 3 important things: discipline, determination, attitude. Attitude means networking. Those who are disciplined, those who are determined, and those who are networked are the ones who became extremely successful at the end of the day. And what determines how, if you look at, again, different people, there are 4 different types. First says, I want to be successful, I won't do anything about it. You can't just sit down and be successful, you have to do something about it. The second, most people are this, including non-doctors also. Average life, average goals, average outcomes, they're happy in life. The other ones who fail and got depressed, but those who dream big, who are the ones who finally make it in life. And then, so what you must do is that all of you should have a realistic ambition that today, okay, you are doing your surgeries, you are very successful, but tomorrow you can't become a Professor Sancheti. There is some difference. It has to go stepwise. Also, you should take reasonable risks. Don't take huge risks because you are responsible for your families, you are responsible for people around you. So if you take huge risks, if it doesn't come out, so take reasonable risks so that something happens, you can still bounce back and come. And important that failure is never final. You can get blocked by the toll, but there are side roads around it you can come. This is very important. So this is a very, very important study that was published a few years back. There's a book called Troublesome Inheritance, which actually classify people into different, some may be good at college, bad at college, average, 3 groups of people. This is natural genetics in all of us. Who does well, who doesn't well depends on something which is most people, average people continue like this, but good people, you can see that some of your students in the college very good, but they don't do well in life. Some who are not good, average, do very well in life. What actually determines is the attitude they get 5 years after they pass out of the college. 5 years after medical college you pass out, your attitude is what determines how successful you are. Attitude meaning social determination, discipline, and networking, these 3 things. So what happens immediately after the college, and this is very good studies which have shown this, these books I'm just quoting for you to read. So I'll just like to say success is not an accident, it's the result of an attitude. If you think you can, you can. If you think you cannot, you cannot. Either way, you're right. But it's only the positive people who get the results. So as a doctor and entrepreneur, it's important to have this important concept. This is Daniel Kahneman who got the Nobel Prize for economics. He said there are 2 types of thinking, the fast thinking and the slow thinking, and this is a very good book on that. As a doctor, you must all have fast thinking, instinct thinking. You're opening, there's arterial bleed, you have to go and catch it, stop the bleed, and so on. But as an entrepreneur, as somebody who's running that, you must have slow thinking. You must rationalize, think, is this decision right? Is this decision wrong? Discuss with people and come to it. So totally different approaches. And we have to integrate both this to become well-known. It's often said, can you still be a good human being and also be successful in business? These are 2 examples. They are 2 very good human beings, but they've been very successful in life. So in fact, being a good human being is also good business. People start saying, okay, this is a good group of people. So we'll go and see them as doctors, The other important thing is whatever you do in life, you have to enjoy because nobody can do hard work. Hard work is the most impossible thing. So what we have to do is smart work. Convert your hard work into smart work, and that you do by enjoying work. For example, I'm a gastroenterologist. Whole day I'm doing endoscopies. I convert this into an enjoyment. I'm seeing something else in the screen. Every patient has a story. Every patient's got an interesting lesion. So convert it into smart work. When you're operating, for example, keep gossiping with your nursing staff, gossiping with the doctors around you. Make it fun. No? That's the way you can go. The other important thing is this Rajat Gupta, a very famous McKinsey president, when he visited us once, I asked him again, same question, how did you become so important? So he said, a very important thing to me, he said, whenever you reach your comfort zone, raise the bar, set the bar higher. You may be practicing, reach comfort zone, making a lot of money, set up a nursing home. Maybe doing well in nursing home, go higher bar, set up an institution. So each time you set a higher bar, you do better. This is very important. And also be friends with your colleague. This is something, again, medicine doesn't teach us. This is my colleague GB Rao, 1997, 2025. We are still together. Only our hairstyles have changed a little, but otherwise we are. So this is also very important. So what we have done by creating this institution that Parag showed you, we created a valuation. So the institute, the doctors, everybody gets valued. We create a patient-centric and academic institute, and of course society benefits. We still have a long road. I'm now setting my bar a little higher. We're going into other cities and so on and expanding our own place. Many of this I've achieved because of luck, serendipity. I can't go into the story because some interesting stories are there sometime later. But I think it's important to realize that great things are not done by impulse, but by a series of small things coming together. Small things happen in your life. You have to grab these chances, and then once you grab this chance, then of course the final result. This is a very good book that I'll recommend you to read called The Fluke. How in our whole life there are a lot of flukes occurring. Only when you recognize this fluke, grab this opportunity, then you get the final results. So all of us have to set smart goals, specific, measurable, achievable, realistic, time-bound. And these smart goals are very important. Just don't make very aimless goals. So I'll do next this thing, I'll do. No, next 3 months I'll do this. Next 3 months, next 3 years I'll do this. So for me, formula finally for building responsible institutes are serendipity and luck, very important. Converting your hard work into smart luck. Team and communicating well with the team. These factors will determine. We run courses now with ISB on entrepreneurship. If some of you are interested, every year, twice a year, we do this course where doctors are taught about all this entrepreneurship in more detailed fashion, especially the financial aspects and so on. And I think, as I said, it's the team that's responsible. It's the power of subconscious mind thinking that we have to do this, we have to, all that we are a result of what we have thought. You keep thinking very positively and everybody can achieve what they finally want. And finally, let me end with this. I compare this like a glass ball, rubber. Rubber ball is like your work. You throw it down, it bounces back. You can lose it, it comes back. But glass ball is family, friends, and health. Once it drops down, it breaks, it never comes back. So look after this very carefully. Look after your family, friends, and health, because this is something you can't bounce back again. So, ladies and gentlemen, thank you very much for your kind attention. Just a few thoughts on what I
I think this was a fantastic oration, sir. Means in 20-25 minutes, you've just shown us the gist, and that is why Dr. Nageshwar Reddy is Nageshwar Reddy. A big round of applause for sir. And on his behalf, I invite you to visit his hospital. Sir, I hope I can take that liberty.
Thank you, Parag. Thank you very much.
Thank you very much. He has a flight to catch, so we'll not take any questions. Please have a seat, everybody, because he has a 8:50 flight to Pune, actually, the city where I come from and Sachin comes from. Thank you, sir. Thank you very much.
Thank you so much, dear friends, for staying with us. And it was absolutely a huge eye-opener. And thank you, Professor Nageshwar Reddy, for this fantastic oration and completely very motivational for all of us. A couple of housekeeping notes. Our dinner will start in the lawn, which is adjoining shortly right now. That's the first point. The second is tomorrow morning we have breakfast with the masters or meet the masters. So in the breakfast room, we'll have 8 tables which are set up. And that starts at 7:30 in the morning. We have key leaders like Dr. Ashok Rajgopal, Dr. Savya is there, Dinshaw is there, all of us very important people amongst us, and we can have any academic, non-academic discussion with all of them. And of course, our sessions will start dot on time at 8:50 in the morning. So thank you for a very sort of intriguing and engrossing and engaging day one. Let's all join for dinner, and we'll see you in the morning as well. Thank you.